Hello, Dr. Simon.
Hello, Hema. Nice to meet you.
Dr. Simon, IBD was a disease that was predominantly seen in America and then European countries. Now that we see it even in the Asian and Middle East, what do you attribute it to?
I'm Professor of Gastroenterology in Oxford, and IBD is the term we use for inflammatory bowel diseases, which includes ulcerative colitis and Crohn's disease. And you're right, this is a condition, there are two conditions, probably more than two conditions, which has been increasing exponentially, not just in India, but also in the Gulf states, in East Asia, and it is now beginning to approach the prevalence of some areas of Western Europe where it has been known about for 150 years and where it is seen as a Western disease. Why so? Well, what's changed? The genes haven't changed. People may have migrated, but the genes are the same, and the change has been too rapid. So it must be something to do with the environment. What has changed in the environment? Well, food has, for instance, and we've moved from a traditional diet, which necessarily vegetarian, may include meat as well, to a much more convenient food diet. So food is the most obvious change which has happened in the past 20, 30 years. And if you ask senior gastroenterologists like Dr. Reddy here at the Asian Institute, then when they were medical students, they rarely saw any colitis or Crohn's disease. Now they see it frequently, but it's not just food. Other aspects of the environment is cleaner. There are fewer helminth infections. There are more antibiotics in childhood. There is refrigeration. There is packaging of food. So we can't just blame the food industry. And the trouble is, for us interested in the reasons behind ulcerative colitis and Crohn's disease, the research to try and find the cause or the causes and a cure, is that probably it's all of the above in different components. So what is changing, I suspect, is a change in the bugs in the gut and an interaction with the genes in susceptible individuals to provoke inflammation in the gut, which is characterized either by ulcerative colitis, causing bloody diarrhea and just affecting the colon, or Crohn's disease, where it can affect the small gut as well and causes abdominal pain and diarrhea.
So these two being immune system attacking diseases, is there any research going on in the field of gastroenterology so that stem cells can be used, for giving treatment?
So it's a good question. Fundamentally, what's wrong with the immune system which gets overactivated, overheated like a central heating, which is the thermostat's turned up too high, where the immune system starts damaging the gut itself. There are lots of new drugs trying to modify that, turn the thermostat down. But one of the most intriguing areas in Crohn's disease, not more than ulcerative colitis, then the question of whether stem cells are the key. And we've done work in a multidisciplinary project within and the UK, looking at the effect of stem cell transplantation in Crohn's disease. And we take the patient's own stem cells, and then chemotherapy abolishes the bone marrow. The bone marrow is then reactivated by careful use of certain stimulators, and then the patient's stem cells are re-injected and they repopulate the bone marrow. And that shows that you can change the pattern of Crohn's disease. You can't really cure it, but you can change the pattern, improve the responsiveness to other drugs. But it carries a cost, and the cost is the consequences. The mortality may be as high as 2%, and that's why we're doing another study which has just started in the UK, looking at a lower dose of chemotherapy to try and improve the safety. Fortunately, only a minority, very, very small minority of people with Crohn's disease ever need such radical therapy. Most of our people with colitis or Crohn's can be treated with conventional medicines or biologic medicines, and these have really changed the face of management.
Thank you so much, Dr. Simon, talking to us.
Thank you.
Great
Very
talking
nice
to you.
speak
Thank you so much.
Okay.